Look, I'm here today with Dr. Katie Richards. We're at Sydney University, where Katie has done a clinical trial on the efficacy of EMDR on binge eating disorder. So I thought that'd be great for us to hear a little bit about just the background to EMDR, Katie, and how your trial has gone. And we're also, if you hear anything strange in the background or see a little head pop up, we've got a beautiful dog here called Nugget as well. So there's three of us in the room, even though you may not see the third being. So Katie, when you started this trial, what was it that got you to start it? And perhaps if you go a little bit into the background of EMDR as well.
Yeah. So EMDR is eye movement desensitization reprocessing, and it's a method that was designed in 1987 by a psychologist called Dr. Francine Shapiro.
Okay.
And she used to work with trauma victims in the police force, and she found that the movements, eye movements from side to side really helped de-traumatize people. So she developed this technique over the years, and since then it's been researched extensively, and it was initially just mainly for trauma and post-traumatic stress disorder.
Got it.
And then since then it was developed into working for other disorders, including depression and phobias and those sorts of disorders. And I learned it in the States when it was really quite new, back in 2001. And back then it was a 1-day or 2-day workshop, and the facilitator mentioned you could use it for addictions, and it was one sentence that he said, and I'd worked in the field of addictions, drug and alcohol and gambling addictions back then, and I was using it for that purpose and also for trauma, and I found that the results were a lot quicker, and so the efficiency was that it cleared trauma within 10 minutes. So
wow.
That was quite exciting for me, to have been trained for 8 years, to know that people had to be in treatment for years for things like that, and to find out, well, this is actually a lot quicker. And because I was working in the addiction field, I was also working with food addiction and binge eating disorder, although there's some controversy about whether it is a food addiction or not. I've always seen it as a food addiction, and conceptualizing binge eating disorder as a food addiction was for me quite easy to then transfer EMDR onto the binge eating, because there's a sort of a drive and a sort of a one-track sort of mind when you think about I just need to get something to eat. And I was working with a lady who was struggling with binge eating, and she had this obsession with eating hamburgers and chips and chocolates, and I was working with her using conventional methods at the time, because I hadn't really thought I could use it for binge eating at the time.
Got it. Yeah.
So this was back in 2009, and I just said, let me just try something, and I asked her, would you be open to trying something different? And I started using the EMDR for that, and within 5 minutes she said, I don't want to eat burgers, and I don't want to eat chips.
Yes.
It was just so quick, and I was blown away by this, and since then I've been using it with other people, and the results 9 times out of 10 were like that. It was quite instant, the way that we just put off that food. And it was sort of like when you work with drug addicts and you say, well, the trigger is to go to a bar and not have a drink.
Yeah.
And for binge eaters, it was like, well, if there was a bar of chocolate in front of you, could you resist it or not? It was that easy where they could just say, I don't want it anymore. And then I was so excited about it that because I was getting results, people were not only stopping the binge eating, but they were also losing weight.
Yes, okay.
And I phoned a few universities, and University of Sydney was one where I found a professor who said she'd be very willing to be my supervisor. And I said, well, after almost at the time, well, it was sort of in 2010 that I decided to go ahead with thinking about actually enrolling as a student again after so many years
Yes.
having graduated
Yes.
and being a clinician.
Mm.
And then in 2012 I applied, and 2013 is when I started to write up the research. So it was only in 2014 that I actually started the actual research process.
Got it. And look, just to let everybody know also, this is how I came into contact with you, because I saw an advertisement in the newspaper that I could not resist, in as much as I do not doubt that binge eating disorder is an eating disorder per se, and I do not for a moment waver on the fact of the addictive nature of food, because I lived with that particular problem, and I am still wavering. I've been through the 10 weeks with you, Katie, as you know, and I found some immediate changes in myself, but I still, and for me, I do get where it's come from, and it's about numbing my emotions. I'm more comfortable with emotions, I'm working on all of that, and with your help, it did shift for me. Still a work in progress, but I am incredibly grateful to have come into your program, and this is something that I think is just such a big problem, and so fantastic that if it's 9 out of 10, and if I'm one who doesn't get the as quickly as others, that's absolutely fine, because for the 9 people, to get over something like this is so life-changing, and it's almost you feel lost, and I think for me I need to explore that little bit of lost, who am I without it question, and what do I do with the time and energy that I use for that. But this is not for me to take over from you, because what's so interesting is your insight into this with all of the people you have worked with, I should say.
Yeah, so initially when we started the study, we figured, well, how many sessions will it take? And I said, well, I've had people who've been, had that problem resolved within 2 or 3 sessions. And in fact, it was at a point where I said to my supervisor, let's just see how many sessions it will take. And she said, well, let's rather make it so that everybody just has 10 sessions. And we said 10 because it was really to fit in with the Medicare model, because at the moment Medicare says you can only have 10 sessions a year. And I said, well, that sounds like a good plan. At this point, we're finding at this point that most people are needing more than 10 sessions.
I see. So I'm not the one. I'm not the 1%.
Yeah.
Okay, good to know.
And it seems to be something in the people I've treated before. Maybe 20% of people in my private practice who've only needed 2 or 3 sessions. I've had one man in particular, he only needed 2 sessions, and he actually then referred somebody else who had come all the way from Caringbah and said, well, Caringbah to the mountains, which is I think about 80 kilometers or something. Come all the way. He said, well, I'm here today, treat me today. I said, oh, I can't make any promises, but unfortunately he had some other major issues that needs to be addressed first. So I think it looks as though most of the time people need more than 10 sessions. But if there are other more complex issues, if there's an additional disorder such as anxiety disorder, marital discord, depression, or something else going on, then it can be treated quite quickly. But I find that the most successful people for me were the ones who had a sexual abuse history.
I see. Okay.
And according to the
that kind of in a way makes sense too, doesn't it? Because a clear cause that you can go to, I suppose, is helpful in a sense.
Yeah. And I've really haven't quite figured out why that is. I mean, as you said, it's a clear cause that we can just sort of address and then it's all gone. And according to the EMDR model, it's based on a model called the Adaptive Information Processing Model, called AIP. And what that means is, under normal circumstances, we process traumas quite adaptively, meaning something happens and then we can sort of put it into our logic mind and process it to the point we can say, well, I've overcome it and I'm sort of better off for it now. It's sort of like people who, might have a car accident and they then learn, okay, I must remember not to be distracted by a mobile phone. So that's what we call adaptive processing.
Got it. Okay.
So with trauma that's not adaptively processed, we have then these symptoms, and one of the symptoms can be binge eating. And sexual abuse is that sort of trauma that cannot be very easily processed by the parts of the brain that need to process it.
Sure.
So what I believe happens is the trauma of the sexual abuse seems to just gets processed during EMDR in a way where they can say, I no longer have shame and guilt and disgust about my body.
Yeah.
And that then translates to weight loss and eating more adaptively.
Okay.
So I've had situations in which patients have come to me for an unrelated problem. They come for depression or for obsessive compulsive disorder. I've treated the obsessive compulsive disorder in one session with EMDR as well. And then I usually say to them, if it's quite obvious, you are morbidly obese, is that something you want to work on? And most of them will say yes, of course.
Yeah.
But it's not usually something that is addressed, unfortunately, in therapy, because they've come for depression, so let's treat the depression. Whereas I find in most cases the depression is so linked to binge eating disorder.
Yes.
So if it's another disorder, I'll treat that disorder that they come for, and then I'll go for binge eating disorder, and very often they're all sort of interlinked anyway.
Oh yes, yes.
So in the example of the lady who had obsessive compulsive disorder, I treated the obsessive compulsive disorder in one session, and then I went to the sexual abuse, treated that in a few sessions, and by the time we got to session 10, she had, cleared all her binge eating behaviour and was starting to lose weight, and she was starting to get motivated to go to the gym.
Yes.
And that's where I would have said, well, that can be treated in 10 sessions, even though there was another disorder, which is, strange again. So
yes,
it's really, we still have to do so much more research into finding out, well, who does it work for and how many sessions are needed.
Yes.
And it's quite hard to say, because at this stage, according to the research that I've done here, we've only had 43 participants.
Okay, yes.
But most of them have needed more than 10 sessions.
Yes, yes.
But then again, there have been results, not to the point where they've stopped binge eating completely, but there have been results where they've been not eating as much or as frequently.
Well, that's where I would say I've fallen, into that category as, as I say, a work in progress though, because I'm not going to stop. Now that I've got this far, I just, you keep looking for the solution. Is what I reckon now, is that just do it and have a life without this particular problem, or whatever particular problem it is. As you know, I was motivated by being in menopause and finding that there was enough to deal with in terms of, generally wanting to get my health back on track, because immediately I start eating too much, or processed foods in particular, I get fairly severe menopausal symptoms. So my body is sending out alarm bells to me about, look, if not now, when? Just do it. So, as I say, this was just so fortuitous that I happened to see something in the newspaper, come along to you, and now know what I know about one way to certainly give your best go at working through.
And I think it's hard for us, as women in particular, men of course as well, but we are constantly getting these messages, we have to be a certain way, so we have to, it's binge eating disorder is one of the most neglected disorders in psychology. We know that people get depressed, we know that people get anxious, we even know about anorexia and bulimia, but binge eating is the one where you keep thinking, well, there are so many people on diets, and we keep getting messages from the media that all you need to do is go on a diet.
Yes.
And we know that and failure of diets.
Really, all you need to do is go off a diet, as far as I'm concerned. And I think that may have been something that's been holding me back as well. I've, really been trying to not worry about what my weight is, to be focusing more on how best to nourish myself and how best to feel well. But gee, that's a whole different mindset. And immediately I'm stressed or tired or any of those kind of states that take you out of your logical mind and you back into the primitive part of the brain, and emotion is everything, and it just I click right back into it. So, but I'm happy to be at a stage where I can just talk about it. The whole shame bit, and that's a big bit. If that one's shifted, and if that was all that would shift, okay, all right, I'll take it. But there's such an open door now on how to be working with all of this kind of stuff. So, it's a good time to have a problem. In some ways, isn't it? Yeah. But look, I think that's fabulous. Thank you for all of this now, that you've just summed up something very, very complicated in a nice, easy to understand way for people to hopefully then feel a little bit more confident about how they might want to approach somebody to help them. Initially the doctor, as you said, and this is for people in Australia, there is a Medicare arrangement whereby if you tell your doctor you've got this problem, then you're able to, at a very low cost, see a professional like you, Katie, and get help with this. So thank you very much for everything.
Pleasure.